knee cars. So for these, you want to be sitting on the floor and you're going to have one leg out straight in front of you, and then you're going to wrap the same side arm underneath in your knee pit. And then you're going to take the other hand and place it on top of your knee, so like your thigh, because what we're going to try to move is this part of your knee. The tibia and fibula actually rotate just ever so slightly. So what we're trying to do here is access that rotation through this range of motion. So you're going to lift up and kind of hug your knee in towards you. I'll go ahead and relax. You're going to kind of hug your knee like, like that, like up in the air. Yeah. So from there, you have your leg elevated off the floor. And you're going to think about turning your shin out into external rotation. Your ankle might go along for the ride, but we want to think about using this point and then extending, and then at the top, rotating that shin inward. Good. That ankle's going to go along for the ride, come back down. So we're imagining the shin bone rotating out. Then we extend. The hamstring's going to stop you. You're not going to be able to get completely straight. Then you'll rotate in again into internal rotation and then come back down. Good. Now the reversal of that is stay internally rotated, extend from there. Good. Keep the hand up here. And then externally rotate that shin out and bend into flexion. Rotate, internally rotate, extend, externally rotate, and come out. If you find it hard to connect with that rotation, a drill you can use is simply draw an X on your shin if you want to. That might help. But simply just stay in this position and think about rotating the shin in and rotating the shin out. You can even take your own hand and help move that shin yourself. Watch yourself do this in the mirror and really try to connect with the rotation, because this one is rather difficult to connect to. Even I have difficulties connecting to it. Common compensations on knee cars. There's two possible things that can happen. First one is that your ankle will do all the work for you instead of the knee actually rotating. So try to keep that ankle locked up into flexion and really focus in and drill that knee rotation. The other thing that can happen is your hip will try to rotate and do the work instead of the knee. So try to keep everything to just the knee. I personally ran into like hip cramps when I first started doing these. So just being aware of if your hip's trying to activate instead of the knee, and really focusing in, relaxing that and connecting to the knee.